Ano to besh? This condition is called pericarditis, the inflammation of the pericardium. So what exactly is a pericardium? The pericardium is a thin fibroelastic sac surrounding the heart and the roots of great vessels. This holds the heart in its position in the mediastinum while allowing it to move vigorously and contract rapidly. This is consists of two main parts: the outer layer, which is the fibrous pericardium that protects and anchors the heart to the mediastinum, and the inner layer, which is the serous pericardium, including the pericardial cavity filled with small amount of fluid that helps in lubricating the heart. Cells in the serous pericardium does the cycle of secreting and reabsorbing of the fluid, maintaining its volume not higher or less than 50 ml. So what causes the inflammation of the pericardium? Mostly unknown. That's why it's called an idiopathic pericarditis. But sometimes it is linked to infections such as viral infection, bacterial infection, fungal infection, and parasitic infection. In those patients who has an autoimmune disease such as lupus, rheumatoid arthritis, and scleroderma are prone to develop this kind of condition. Persons who experience heart attack and undergo heart surgery have higher risk to pericarditis. It is due to the error of body's response to the procedure or condition, and it may be due to injury to chest after trauma or accident. So how does the pericardium get inflamed? Regardless of its cause, the fluid and the immune cells starts to enter from the blood vessels of the fibrous and serous pericardium to its interstitium layers, making those layers thick. There are several types of pericarditis depending from its causes, and one of the most common type of it is the acute pericarditis. This sudden begins but with no cause, and it is mostly linked to viral infection, where a patient experiences chest pain that may reach to the left shoulder down to the arm, which is oftenly mistaken heart attack. Then, a severe form of pericarditis is known as the constrictive pericarditis, which is inflamed layers of pericardium becomes inelastic and stiff, decreasing the space for movement of heart, interfering its normal function. Generally, here are the main symptoms of pericarditis: fever, chest pain, in which a person may experience difficulty of breathing but lessen when sitting up and leaning forward. And other symptoms include pain in the back, neck, left shoulder when lying down, dry cough, anxiety or fatigue. And this can be diagnosed by auscultation, a non-invasive procedure where it produces a friction rub from rubbing of the thickened layers that can be heard through the stethoscope. Tests such as X-ray to identify the size of the heart and to observe if a fluid is present in lungs. Electrocardiogram or ECG to look for changes in heart rhythm. Cardiac MRI to check extra fluid in the pericardium, and cardiac catheterization to determine the filling pressure in the heart. And pericarditis can also be treated by medications. This varies on the cause of pericarditis. For acute pericarditis, ibuprofen and aspirin can be used to reduce the pain and inflammation. And if symptoms are severe that have lasted longer than 2 weeks, a doctor may prescribe colchicine. But remember, when taking these medications, it must be prescribed by your doctors. And also, Surgery can be an option, but it depends from the type of pericarditis. If there is a buildup of fluid in the pericardium, which compresses your heart, thus pericardiocentosis is recommended. And that's all. Always remember prevention is better than cure, as our health is our wealth.